Okay, thank you very much. So, to conclude, previously everybody see our child lesson, everybody see our Dr. Emma explaining our university, and also our college director Corinne to explaining, if you join us for the nursing courses, either for the intentional stage 1 or pre-master, what support you'll get. So from my side, I'm going to give you, the information about the course intake day and the scholarship. So for our courses, we do offer scholarship for our international students, range from £1,000 to £4,000 scholarship for our pathway courses, such as our international stage 1 or international stage 2 or pre-master. So the international stage 1 is like England's foundation. The international stage 2 is like England's international first year, and pre-master is everybody can tell from the wording. So the very good news for all our international students who study at ICD Dundee, as study at ICD colleges with us. So if your students or maybe yourself decide to join our ICD international stage 1 or international stage 2 courses, and later on you manage to get your your progression grade for 60% and above, then the university is also going to reward you for your excellent study. So therefore, you will have excellent scholarship, which is going to be £5,000 per year on your progression year. And if you are studying with us for pre-master at our ICD colleges, if your final grade was actually between 60% to 69% or even higher, then for your master courses, progressed master courses, will also give you an excellent scholarship for £2,000. So this is actually added up together. If you are getting a £4,000 for your pathway courses, but at the same time you get £5,000 for your progression courses, you can see like we are trying to incentivize the excellent students basically. And this is our current tuition fee. So you can see if you study our nursing courses directly, if you study our international stage 1 and your IELTS is 5.5, no less than 5.5, then your tuition fee will be £17,595. As if your IELTS is 0.5 below the required grade, then we were asking you to join 6 weeks pre-sessional, which is £20,000 and £95. And if your IELTS is 1.0 below the required grade, then we're asking you to join the 12 weeks pre-sessional, which will lead to the £22,595. And meanwhile, if you are coming to study the pre-master for the nursing related course, and so for one term pre-master is 8,995, and again if you are 0.5 below the required grade, then we will asking you to join the 6 weeks pre-sessional. That will be £11,495 basically. And if you wanted to know like how much is it after you finish your pre-master or after you finish your international stage 1 courses, yeah, feel free to go into our Dundee University website. For example, if I go into Dundee, I go into the undergraduate courses and I click on the adult nurses courses, then you'll be able to see our fee and foundings over there. So our intake day, just to let everybody know, due to the COVID-19 and now at the moment we are in the lockdown, so our class deadline does postpone a little bit. So we still have a January intake, and our class assigned deadline is on 25th of January, and our latest enrollment day it will be 1st of February. And at the moment, due to lockdown, you can try to we accept virtual online registration, so you don't need to worry about you need to arrive in England. Oh, sorry, you need to arrive in UK, Scotland by 1st of February. Meanwhile, at Center, we also have a September intake. And for our international stage 2 courses, we have January intake and September intake. And our class assigned deadline for the January is also postponed to the 25th of January. And the latest enrollment day is 1st of February. And for our pre-master courses, we have January intake, we have February intake, we have April intake, we have June intake, we have October intake. The reason why we have so many intake is because like we're trying to cater to global global education system. And meanwhile, it's also like we know like pre-master tend to come from the mature or people coming from the work experiences or people who want to we want to rebuild a new skill. So therefore, like we open multiple entry. And as you can see for our January intake, we've now published that our class assigned deadline will be 19th of January and our latest enrollment day will be 25th of January. And for the courses you can choose in order to be a qualified nurse or in order to be a nursing related occupation. So for our international stage 1, our nursing courses have adult nursing, child nursing, and mental health nursing. And for our pre-master, we have 1 term pre-master. So the 1 term is equal to 3 months, as Corinne explained earlier. So we have nursing and health program. So just to re-emphasize that all our courses, no matter it's for undergraduate pathway courses or postgraduate pathway courses, as you can see over here is that we sponsor you the whole visa length until you get your degree. So that is until you graduate. So if you study, you decide to study with us for international stage 1, we'll give you 4 years visa. And if you also happen to need 6 weeks or 12 weeks on top of your international stage 1 study, then we will also include in the pre-sessional English courses visa into your visa lenses in order to cover you until graduation date, basically. So that sensing is also applied to our pre-master. So as you can see, either you study 3 months, 1 term pre-master, or 2 terms, 6 months pre-master. And on top of that, if you need to do additional 6 weeks or 12 weeks pre-sessional, it all can be included and until you finish your master degree. So it's a 1 visa policy applied to all our courses. So I'm gonna re-emphasize what Corinne already mentioned. In our colleges, we emphasize on the small classes, and we have experienced teaching staff, and also like we definitely set up in a Dundee University campus. We are not like a colleges like set up in a maybe middle of nowhere, or maybe somehow you are in London but your university is in Dundee, so you that kind of thing wouldn't happen. We are definitely ensuring like all our ICT students will actually base in our Dundee University campus to enjoy the same rights as a Dundee University student. And as I mentioned, it's a 1 visa to cover the whole course duration until you finish your degree courses. And you enjoy the full university status. And importantly is that you will, once you finish your pathway courses, you will then continue to your progression courses at Dundee University. And like I mentioned, if your IELTS is lower or if your internal English test is lower than what we required, then we will also offer you 6 weeks or 12 weeks pre-sessional. So if you have any questions, feel free to contact me. And if you would like to submit your application, and I would suggest that contact your agent, and at the same time, like if you do have any question, your agent will collect the questions from you, and then she will contact me. Angela will contact me on behalf of you, and I'll feedback Angela so Angela can feedback to you. So now we will move to the Q&A sessions. So if anybody have any questions, please do drop it on the chat. So I will be if you are quite shy, please send me the private messages. I will base on the questions to assign to our my colleague, sorry, to assign to our colleague, so that they can helping you to answer the question. So please do feel free to raise your question in the chat boxes or send me a private messages.
Thank you, Shu.
Welcome.
So we are going ahead for some questions. If anybody got any questions, please type in the chat box.
Yes. Dr. Emma, I think this side I have one question is that hello. Hi Emma. So I have one question privately is that people were asking for students who already had nursing qualification, if they decided to come they decided to come for the pre-master for the nursing and health, and then later on, they because they understanding this course is not nurse accredited, how do they still become a nurse, a registered nurse in the UK?
Yeah,
is there any support from the university as well?
Yeah, that's a really good question. So what needs to be done? We register with the Nursing and Midwifery Council. There's an online exam that students that people have to take. And then also there's an OSCE simulated practice session that needs to be undertaken within a simulated environment. So what would happen is the student would come to us initially and say that, can we get help? And we'll just help them navigate through the NMC registration documentation, help them register for sitting the exam and for the OSCE. So they'll get lots of support. There's a few things that needs to be done, but it's achievable with support, and we'll give them all the support that they need to do that. It takes a little bit of time, so we probably, if the student thinks sort of halfway through their program that they might want to do this, then if they let us know as early as possible, so we can start working way through the documentation, what they need to do.
Cool. Thank you very much, Dr. Emma. So I will answer one of the questions raised by Pooja. Thank you for sending me privately. So Pooja asking, what is the academic requirement for India and also the English requirement? So I'm going to share my screen to let you guys know where you can find out our entry requirement for different nationality. So you can see over here, this is our entry requirement, academic entry requirement. So if you want to know about our English entry requirements, so I will also mention to you, so you can see over here, for example, in pre-master, if you want to go for one term, we will actually mention your IELTS requirement will be 6.5, no less than 5.5. If you want to go for one term pre-master plus 6 weeks pre-sessional, then it will be 5.5, no less than 5.0, except writing must be 5.5. I think, Colleen, this question will be nicer for you to answer to re-emphasize the messages. Dundee is in Scotland, so if a student did the international stage 1, similar to England's foundation, are they progressing to year 2 or year 1 in Dundee University?
Okay, so for most of our pathways, they would progress to year 2. Most Scottish students also have to do 4-year degrees. The Scottish system is a 4-year degree system, which is very different to the English system. Nursing and law, there's 1 degree in computing, are 3 to 4-year degrees, but they're accredited. So you've heard Charlie and Emma talk about the Nursing and Midwifery Council professional accreditation that a nursing gains. Now, because they're those accredited courses, then we offer a foundation course for nursing. So the short answer is, for most of our courses, we're a year 1 that progresses to year 2 in Scotland. But for nursing, we're a foundation year that progresses to year 1 on the nursing degree.
Okay, cool. Thank you very much, Corinne. So on top of Corinne's one, I will also make sure where you can find this information. So to re-emphasize back to Corinne's answer. So basically, you can see from here in our brochure, we mentioned for our IIB courses, we actually offer IS1. So for the IS1 courses, normally you finish IS1, you enter Dundee University's 2nd year, which is year 2. And then year 3 and year 4. However, as Corinne mentioned earlier, as Dr. Corinne mentioned earlier, nursing courses are slightly different. So if you've done the stage 1, then you enter the 1st year of the nursing, and then the 2nd year of nursing, and then the 3rd year of nursing. So you're still using 4 years to completing your nursing degree at Dundee. So that's the differences. But so the fundamental message here, just remember 4 years for your, including the pathway courses for your nursing bachelor degree courses. But the good thing about the nursing degree courses, as our Dr. Emma and also the Charlie mentioned earlier, that our undergraduate degree is accredited by the nursing society. So the students then can practice as a nurse if they've completed the required paper, basically. So again, the information is in brochure. Please do make sure you use that. Yeah. So I'm also going to check another question. Hi, Charlie. This is a question meant for you. So the students is asking, now is lockdown. So how did university teach nursing courses now when it comes to practical? Because our nursing courses has to, in order to recognize by nursing association, you need to have a practical courses. So, but they are overseas. How do they practice?
Yeah, and that's a really good question. I was kind of waiting for it, so I'm glad that somebody's asked it. So you're absolutely right that the COVID pandemic has meant that we've had to really, as academics within the school, think about how we deliver some of our teaching. And as Emma mentioned previously, for pre-registration nursing, there needs to be a 50% theoretical and a 50% practical component in order for nurses to register with the Nursing and Midwifery Council. So I'm pleased to say that at the moment, many of our students continue to be out on placement, undertaking the practical aspects of their program. So they're actively involved in the treating people with COVID, supporting people with COVID, and working in different settings across Dundee and the wider kind of geographical area. Of course, some of our students aren't able to be there for perhaps health reasons or other reasons, perhaps they're living with other vulnerable people. So our placement team have been really, really innovative and clever. So remember in my short lecture, I was talking about harnessing the use of technology and the digital revolution, how that's changing nursing. So our team have developed simulated placements too, and these are giving nursing students the opportunity to really develop their online assessment and consultation skills. So it's a simulated placement where they have case studies to work through, and they're getting to undertake really, really kind of key assessment skills. So that's a really brand new thing that we're doing in the school, and it's something that's really exciting both for our students but also for us as academics too, because we're really keen to see how it's going. And I think we're just in the first week so far, so it's still pretty new, but the feedback so far has been very positive. So it's exciting times for us. And in terms of teaching, our teaching, the majority of it has moved online. So, as we're talking today, we have a virtual learning environment in which we're able to teach students via live sessions, as well as asynchronous or kind of, directed learning that students can undertake in their own time more flexibly. So we've got a whole kind of a range of approaches to dealing with this uncertainty, and to ensure that our nursing students are still able to achieve what they need to achieve in order to register as nurses.
Yes, it does answer the question. And so thank you very much, because I think that's what they were worried about, because they were saying, like, if I don't able to do practical, does that mean I get a degree, but I cannot be a qualified nurses? And so this does answer the question. Basically, we still virtually provided the experiences similar to placement. And then at the end, the students, once they graduate with their, like, for example, adult nursing degree, then they still will be able to be recognized by the nursing association in order to become a qualified nurse, basically. Yeah, thank you very
Absolutely.
much. Yeah, so just to let everybody know, because I know you will probably get a little bit confusing. So about, how was the proportion between teaching and then assessment. So I'm sharing this screen for you. So, and couple of it, maybe Charlie and Emma will be able to help us more. So what Charlie mentioned is that, because as Dr. Curry mentioned, like, once the student finish international stage 1 in nursing, then they will enter the year 1 at the Dundee for the nursing courses, for example, for these adult nursing courses. So in the year 1, this is the module you will learn, and this is not yet having, if I'm not wrong, please correct me, Charlie and Emma. The students in year 1 not yet going to a lot of practical modules in terms of placement in the hospital.
from the offset, students, so right from the beginning, all right, maybe not from day one, but certainly within the first semester, students will undertake a practical placement alongside their theoretical learning. So they really go hand in hand throughout the nursing program. So if you think about perhaps medicine, quite often medical students don't put their hands on a patient, let's say, until they're in year 3. But in nursing, we start really from the offset, helping students to develop their skills, both practically working with people, but also the theoretical side. So, and that really actually shows when you look at nursing students in comparison to medical students sometimes, because they have a lot more confidence, I would say, quite often in dealing with real world situations and caring for people.
Cool. Thank you very much. So everybody can see from the official webpage, this is the year 1's module. And as Emma mentioned, as Charlie mentioned, that you do have a practice over here. So this is nursing skills and practice. So it does come with a theory teaching, but at the same time, you do need to do some like a real practice skill. And then in year 2, we start to have a placement module and also the skills for practice. So these are the one like, this like we mentioned, you need to have a 50-50. So therefore you can see the module here is 50 theory and also including the placement, as well, including the hospital placement. And then also in your final year 3, you also have your placement, your practice as well. So you can see like over here is like at least 40% of your placement working alongside with you, basically. And so you are actually, so I think maybe you guys will be explaining me more, because actually there's one question is that so how many hours in theory the students are study per week, and how many hours are really working in the hospital?
So that would depend on where students were in the program. So at some points of the program, students will be out on placement, and then this is where the 37.5 hours per week comes in. So that's the expectation of the amount of time they'd be spending in a particular healthcare setting, undertaking the practical learning. And that could be during the day, it could be at night, it wouldn't necessarily be office hours. It just depends on the setting. At other points during the programme, students will be what we call in theory. So that's when they're at university or, learning online as some are at the moment. So learning the theory side of things. So it really just depends where students are at the programme. Weeks and days can be very different, and students will also be working at weekends as well as during the week. So, and that enables them really to get a real feel for how healthcare settings work out of hours and not just during the week. So it's giving a real life kind of experience of what it's like to be a nurse working in a variety of settings.
Thank you very much, Charlie. Thank you very much, Charlie. So I think this is the end of our question. Angela, I will pass back the host back to you.
Yes, thank you. So I think it's the end of our presentation today. Thank you very much. I think that's it for today. And also thank everybody. If you do have any questions about University of Dundee or Oxford International Education Group, and please let us know, and we will be here. So thank you very much,
Angela.
Thank
Thank you,
you.
everybody. Thank you,
Bye.
all the colleagues. Thank you. Bye-bye.
Bye-bye.